वैसे तो सर ने आपको एक इंट्रोडक्शन दे दिया है कि ये क्या बीमारी है, इसमें क्या होता है, क्या नहीं होता है। थोड़ा मैं उसको आगे आपको समझाने की कोशिश करूँगा।
Apollo Cancer Centers unveils ColFit, a game changer in colorectal cancer screening. Apollo Cancer Centers (ACC) has launched ColFit, a comprehensive colorectal cancer (CRC) screening program aimed at early detection and prevention amid rising CRC cases in India. The initiative integrates the fecal immunochemical test (FIT), a non-invasive and highly accurate screening tool to identify early signs of CRC, improving survival rates and reducing treatment costs. Dr. Harsh Shah, consultant GI and HPB cancer surgeon at ACC, emphasized the need for proactive screening, citing lifestyle factors like poor diet and sedentary habits as major CRC contributors. Dr. Apurva Shah, consultant gastroenterologist at Apollo Hospital, Ahmedabad, highlighted the alarming trend of late-stage diagnosis in India, where nearly 50% of cases are detected at advanced stages. Commander Jalsan Kawalakkat, Unit CEO of Apollo Hospitals, Ahmedabad, reaffirmed ACC's mission to educate, screen, and provide world-class cancer care through a seamless screening to treatment pathway. By prioritizing early screenings, including FIT tests and colonoscopies, and promoting lifestyle modifications, ColFit aims to significantly reduce the CRC burden in India. Report Bilkul Online.
So Apollo believes in prevention is better than cure. We operate a large number of Apollo cancer centers, and we have a panel of more than 390 oncology clinicians operating various parts of the country. And there are more than 147 odd countries patients are coming to these cancer centers. So specifically, we are launching this program today called ColFit. ColFit is colorectal fecal immunochemical testing. So this is a screening program. As a part of our prevention, we have been launching various screening programs like the breast cancer screening, like the lung cancer screening, and this is the first time in the country such a kind of a program is being launched. Unfortunately, when it comes to cancer, it's always important that it is detected early. And especially when it comes to colorectal cancer, the problem is it should be detected early, but we are not able to detect it. In most of the cases, the doctors will be able to explain to you better. This colorectal cancer gets detected much later. And when they come at that late stage, the outcomes are, of course, very poor. Unfortunately, previously it used to be affecting patients who are above 50 and all, but now the age profile is also coming down, and the numbers are also increasing. Maybe it could be because of the lifestyle, maybe it could be because of the kind of food that we are eating. So colorectal cancer is taking off. Within the last 2 decades, it has increased some 20 to 30%. And the worst part is that some of we wouldn't come to know till the time there is stool in the blood and some of the major symptoms, and by the time it is already very late. So this program called the fecal immunochemical test is a very simple program where a single sample of the stool is tested and analyzed. And if there is anything abnormality, then we go into the various other modalities of testing and all that, that is what it is today. And today we are launching this across the country in all the Apollo cancer centers. The doctors who are with me will be explaining to you in detail what are the kind of symptoms that one should look at and what are the remedies and the cures that we have if you are able to detect it at a much earlier stage, and the benefits of this program. So they'll be driving it as a part of this Apollo Cancer Center and Apollo Hospital of Ahmedabad.
स्क्रीनिंग कैंसर बोर्ड से डिटेक्शन का मेथड नहीं है. दैट इज़ वाई वी आर टेकिंग दिस इनिशिएटिव. ये इनिशिएटिव लेने का मतलब ही ये है कि एसिम्प्टोमेटिक है, उसमें हम रिस्क को डिवाइड कर सकते हैं कि एवरेज रिस्क वाला है जिसमें एज 45 है और बाकी कोई रिस्क फैक्टर नहीं है, और हाई रिस्क है जैसे मैंने जो भी बताया अभी कि पेशेंट एल्डरली है और बाकी रिस्क फैक्टर्स है, फैमिली हिस्ट्री है, इन्फ्लेमेटरी बाउल डिजीज़ है. तो मोर देन 45 सब में हम स्क्रीनिंग एडवाइस कर रहे हैं. स्क्रीनिंग का मतलब होता है कि कैंसर नहीं है, पेशेंट एसिम्प्टोमेटिक है, फिर भी हम उसको अर्ली स्टेज में डिटेक्ट कर लें या पॉलिप स्टेज में डिटेक्ट कर लें, जैसा आपने बताया.
स्टेज 1 में सिम्टम्स यूजुअली नहीं.
सो यूजुअली स्टेज होते ही नहीं.
Guys, in last 2-3 years, how many patients have come to you for screening?
It's a difficult question, but I would say many of the patients which have scope for screening, these are from USA and America and Australia. Indians who are living there, they will come. हमारे डॉक्टर ने बोला हमारे कोलोनोस्कोपी कर दो, उनको सस्ता भी पड़ेगा, उनका हॉलीडे.
हाईली एजुकेटेड पीपल फ्रॉम इंडिया, ठीक है, डॉक्टर्स बेसिकली, उनमें एक स्टडी हुआ कि 45 प्लस से जो भी ज़्यादा है, खुद ने कितनों ने कोलोनोस्कोपी का स्क्रीनिंग करवाया हुआ है, उनके फादर और मदर जिनकी एज मोस्टली मोर देन 50 रहेगी सभी की, उनमें से कितने कोलोनोस्कोपी. तो जो डेटा आया उसमें ऐसा आया कि मेजॉरिटी ऑफ देम 90% आर क्वालिफाइंग कि जिसमें कोलोनोस्कोपी की ज़रूरत है, but only 7% of them undergone the colonoscopy. This is in doctors group from India.
Okay.
Last year data. ठीक है. So the problem is even after awareness, people are not accepting that colonoscopy हमको करा के उसको prevent करें. So it's a very good test to detect. दूसरा क्या है कि पॉलिप अगर अर्ली स्टेज में है, जैसे बताया उसने, कि वी कैन रिमूव इट, कि कोलोन पॉसिबिलिटी जो है 10 साल बाद होने की, वो जिस टाइम पे हम सर्वेलेंस कर रहे हैं या स्क्रीनिंग कर रहे हैं, एट द सेम टाइम वो हम पॉलिप को रिमूव कर सकते हैं. तो वो जो पॉसिबिलिटी फ्यूचर में है वो नहीं है.
There is a positive family history, then you should not wait till attaining 50 or 60. You should go for it
So
much
what madam is
before.
saying is high risk.
Hello, I am Dr. Harsha. I am a GI cancer surgeon at Apollo Hospital, Ahmedabad. So basically today we are discussing about this colon cancer screening campaign that we are starting. We have named it as ColFit. So what is colon cancer? Colon is basically it's a large intestine, and we are talking about prevention of its cancer. So the incidence of colon cancer is quite high in Western countries, and it is also increasing in our country. So it is very essential that we detect in preliminary stages, even before developing cancer, like in the stage of polyps. So for that we are introducing this campaign where we have two tests available. One is a stool test, which is called FIT, where we are recommending it to every person, every individual who has no risk, or what we can say average risk individual, once a year. And if the test is positive, found to be positive, then the individual will be advised a second test, which is called colonoscopy, which is testing the large intestine from endoscope tube. So basically, why screening is important? Look, screening is there for majority of cancers. Like you must have heard about breast cancer, lung cancer. So what is the purpose of screening? The idea behind screening is that if we detect the cancer before happening or in very early stage, then we can cure the cancer, or we can prevent happening the cancer, so that we can increase the lifespan or even cure our patients. And if we talk about Western data, like if I talk about the advantages of screening, which is shown in data wise, then it is said that even you can save 60 to 70% of the mortality, that is deaths occurring from colon cancer. It is said that worldwide colon cancer is the third leading cause of cancer related deaths, and what we are talking about is nearly 8 to 10 lakh people every year. And if we can reduce this by 60%, then you can imagine how much advantageous it would be. So it's very essential that we understand that we need screening and we undergo screening. So that is the whole purpose behind
You're
it.
also mentioning about the survey conducted among the doctors.
So that's an unfortunate thing that has come out in a survey, that we ourselves as doctors are not complying with screening. So that is in one survey it was found that doctors who were eligible for screening campaign, less than 10% of them underwent screening. So that's an unfortunate statistics, but we all should learn from it that screening is essential. We as a doctor, we already understand this, and probably more doctors would understand this, and general population should also take it on a serious note.
I am Dr. Shravan Bohra, Head of Department Gastroenterology and Hepatology Department at Apollo Hospital, Ahmedabad. Today we are here to raise awareness about the colorectal malignancy, यानी कि colon cancer awareness. Unfortunately, the incidence of colorectal cancer is rising in our country at an alarming rate. It is not only affecting the elderly people, but now it's also affecting the younger people. The sad part of the story is that most of the patients with colonic malignancies are diagnosed at a very late stage when the disease has already metastasized or spread to other organs like liver, lungs and bones. In that situation, we don't have too many treatment options, and the lifespan is seriously compromised in these young unfortunate people. So to identify colorectal cancer at an early stage is very, very important, and that's why we are bringing up this awareness program. The simplest test to perform is stool examination. By doing a stool test, if the stool sample is positive for blood, or we are also doing immunological tests on a urine, on the stool, and if that test is positive, it means the patient may be harboring a colorectal malignancy.
So how much time does it take, and how much it costs?
No, stool screening test is very simple. Routine stool test can be done for only 100 rupees, even in a small village of India. And the genetic test for stool is performed at the specialized center, and the cost is about 1,000 rupees, and it takes about half an hour for the reports to come in. The next investigation is colonoscopy, where we have to prepare the patient for doing a colonoscopy, and then we put the patient to sleep, and then we pass a camera from the back passage that is called as colonoscope. Colonoscope is the instrument. Colonoscopy takes about 15 to 20 minutes to perform, and then if there is any abnormal growth in the colon, we can take the biopsy, and that can be sent for histological examination to confirm that the patient may be having a colorectal malignancy.